All right, good afternoon. I'm delighted to be with Donna Holt, Carol Johnson, and Patty Moran, who are going to share with us just some things to look for in our kiddos as they develop from those youngest ages. And if we think we need additional services, just to let us know what services are out there to pursue and how best to pursue them. And with that, I'll just invite each of you to introduce yourselves and your specialties. Donna, we'll start with you. If you could share with us who you are and what you do.
Okay. Hi, I'm Donna Holt, and I'm a service coordinator. I'm starting year 30, and I do work with the Babies Can't Wait program in Cobb County as well as the DeKalb counties in the metro Atlanta area.
Great, thank you. And Carol.
Sure. Hi, I'm Carol Johnson, and I'm a physical therapist with the Cobb Douglas Babies Can't Wait program. Been there for, I'm not going to say how long, but a while. But yes, and work with birth to 3-year-olds.
Thanks for being here. And Patty.
Hi, I'm Patty Moran. In some states, it's called an early intervention specialist. We call that here. And in Georgia, we call it a special instructor. And I've been with early intervention programs for about 20 years. And here in the Cobb County, Atlanta metro area for 9 years. I've also worked with preschool special needs and K-2 population too, as an educator. So.
Thanks so much, you guys. We're going to jump right in. We'll run through some of these questions, and then as you kind of bounce ideas off of each other, feel free to interject pieces that may be missing or that you think we need to add to the conversation. But we'll start with just asking each of you, what do you think are the 3 most important milestones to watch for in our littlest infants to 6 months, and then 7 to 18 months, and then 19 to 36-month-old children?
Well, I can start it if you like. Being a physical therapist, I'm looking at gross motor development, the large muscle movements, the sitting, crawling, and then up to walking, running, jumping, those type of things. And so when I looked at some of the key things that I kind of look at for, the birth to 6-month-old, at the earliest age, right around 2 months, I'm looking for the baby to hold their head up on their tummy when they're laying on their tummy. 4 months, I think, with gross motor skills is a key time to look at midline. Are they able to hold their head in midline? Are they able to bring their hands together, maybe to touch the bottle or touch a toy? Are they bringing them together and clasping them together? Midline orientation is big at 4 months. And then at 6 months, we're looking at, is a child starting to sit? Are they able to maintain like a prop sit position, meaning like if you put them on the floor and they put their hands on the floor, they're able to maintain that position. And really, they should really be moving toward like sitting independently at that point. So that's what I'm looking for up to 6 months. You want me to go all the way through, or do you want people to enter? How do you want?
Yeah, we'll kind of circle around and see about birth to 6 months from the two of you, and then we'll come back around to you, Carol, for the next age group. Thank you.
Okay.
What I was thinking about when I'm looking at birth to 6 months is that self-regulation piece in the areas of eating. Are they just starting to take milk? Can they have good lip closure? Are they starting by 6 months to take some solid foods? Is there sleeping? Are they starting to get on a pattern of sleep? And are they starting to explore their environment with their senses? Are they looking? Are they listening? Are they grasping? So, and also that other area, the oral motor with their feeding. So that's what I thought about for those kind of 3 key areas.
Great, thank you. How about you, Donna?
Well, as a service coordinator, that I'm just kind of a general person. So I guess I kind of look for some of those same things that Carol looks for, but more on a general basis. And the same things that Patty, but then also some communication, engaging. How are they doing with are they making any sounds at some point? Are they looking at parents? Are they, expressing themselves through a variety of cries? So those kind of things.
Cool.
That's great. Thank you. So Carol, we'll jump on up to those 7 to 18-month-old kiddos.
Okay. Now that's a huge range. But looking at that 7 to 18-month-old, of course, going back to the sitting piece, right around 6, 7 months, kids, you should be able to sit them somewhere and they're going to stay there. They got enough balance to be able to maintain sitting, and they have enough balance to be able to grab a toy and play with the toy. They don't need to use their hands to support themselves anymore. And then moving on up to, 8 to 9 months, a big one is, are they starting to pull the stand? Or when you go in after a nap or in the morning, are they standing up at that crib? Have they pulled up, or if they're in the living room, are they, pulling up to the couch or pulling up on mom or dad? So that's a big one for that 9-month-old. Right around that same age. I know you told me 3, but I got carried away. But anyway,
You're good.
8 to 9, we're looking at crawling. I like to, see that the babies are getting from one place to another, and they're doing a nice reciprocal hands and knees crawling. Okay. Also, can you put them at the couch and they're walking along the couch, cruising along the couch, the length of the couch in both directions. Also, of course, moving more towards, 15, 18 months, they should start taking steps. I think at 12 months, they should probably be able to stand independently. They should be able to take some steps. And then as you get closer to 18 months, they're definitely walking independently. There's a range of what's considered within normal limits for kids to start walking, and that's 15 to 18 months. So that's what we're looking at that age level.
Thank you. What about you, Patty?
Well, we're looking for, at this age, just that early exploratory play, that while they sit up, if they're sitting up, that they're wanting to grasp objects. They're going to want to look at them. They're going to turn them around in their hands. They're going to bring it to their mouths. They're going to shake it. They want to see what this object sounds like. So that early exploratory play to 18 months, that they're showing us how toys work. That with these blocks, we put them in certain holes in a container. We take things out of containers. We are getting into, even some of the children at 18 months are just in a simple puzzle activity, that we're showing an interest in books. So they know how things work, and they're sitting for a period of time and are engaged, not just with themselves, though, that they're allowing parents to participate in these routines. I think a really good resource for families to look at that is, there's a resource called Baby Navigator, and they say that there's 16 actions by 16 months. There's 16 different play routines by 16 months, and they do go over some early communication. And these are all in these handouts, but that a child is able to do that much at age 16 months. And it's just a good resource for families to look at. The other thing is that it's called joint attention, that they're allowing the families to come in and join them in a routine, and that they're showing a lot of vocal imitation. So we should hear lots of sounds, and even by 16, 18 months, so some beginning word approximations, mama, dada, baba for bottle. So those beginning words are coming into place by 18 months.
Hey, thank you. We'll link to that Baby Navigator on the site. So thank you for that. How about you, Donna?
Again, kind of repeating some of the same things, the movement, crawling, doing some transition of positions, and then more communication to not only just, not words, but starting to use some gestures, some variety of sounds or what we're looking at. Again, are they smiling? Are they looking at parents? Are they, that strange anxiety should have come in by now and they kind of know who their parents are and who are not their parents or familiar people. And I guess that's about it.
And couple more things that they're turning to their name.
Mm-hmm.
Oh, yeah.
That they can follow simple directions. And the first one we always begin with is just give me. It's with a gesture. Give me or put in, that they're starting to receptively follow those directions. But turning to name is a big marker at this age to watch for.
That's great. Thank you. And Donna, I think we'll start with you on this since you coordinate services and then let you call on whoever you think would be great to talk about it next. But when, as parents, might we know that it would be helpful to reach out to our pediatrician for additional supports if we feel like something's kind of off with our child, that we think that they should be doing something that maybe we're not quite there yet? What are those big signs?
I think that if you ever feel like there's something just not right, or someone's said, Johnny should be making a few more words. If you as a parent have a gut feeling that there's something, then I would say, tell your pediatrician. Pediatricians should be doing some type of screener at appointments, especially specific, those monthly appointments, like those 18-month appointments, those 12-month appointments. There should be some screener done. If they do not, ask. That's what I did for my pediatrician. I'm like, so when do you do one? You can always look at the CDC. They have a very nice developmental screener. And at any point, if you feel like you're a child, then I would definitely ask anytime.
And I think too that, if a child is in daycare, your daycare teachers, they're good resources as well, because they know development and they can see that, oh, little Susie, she might not be saying as many words, or she might not be getting, there's something different about the way she gets around the classroom or whatever. And they're always a good resource for our families as well. And in terms of, I think, referring, calling Babies Can't Wait, a parent can do that themselves. They do not need a pediatrician to do that. So don't ever, if you're feeling like I'm not sure, because mamas know.
Right.
We know. And sometimes pediatricians don't see what you see. So call yourself, make the referral.
That's great. Could you say a little bit more about Babies Can't Wait in case people don't know about what a great resource it is?
So
I'm gonna let Donna do that.
Okay.
Go, Donna.
So Babies Can't Wait is the state's program that's out of the Individual Disabilities Education Act. It is that program for babies birth to 3. So we serve those kids. It is fairly funded. It is not completely free, but you do get a free evaluation and a free intake appointment. So a screener. And it is available to any child in the state of Georgia. So like Carol said, it does not have to be, a referral doesn't have to come from anybody but a parent. It can come from anybody, but a parent can make a referral as well. We do provide certain services within that program, depending on how your child evaluates and what your needs are at that point.
And for families to understand, these early intervention programs are in every state. These evaluations are free. And if you ever have a question about a child's development and a pediatrician in those short visits isn't picking it up, then please call an early intervention program where you live. These appointments are free. It's part of the federal law. And I think the other thing I think that's coming up a lot for us, especially in the past 20, 25 years, is many parents are having concerns about autism. So parents are coming into us with maybe one isolated area or something that they're seeing at home, a characteristic. Have these parents please contact us, because we don't diagnose in our programs, but we can talk about development with the families. We can educate them on red flags for autism, and then we can give them resources if they are concerned. So this is a big area of concern for our families that come into us. So we tell them, please take advantage of this free evaluation and get even if the child doesn't qualify, to get information that they need about development.
Thank y'all. That is such helpful information that I don't feel like folks are readily they don't always get that information. So thank you for sharing that. I'm curious if you all could speak a little bit to how early intervention impacts our children as they get older. What are the discrepancies we see between children who receive early intervention and those who maybe don't? And what are the benefits of early intervention?
So the goal of early intervention, of course, is to either get rid of or at least minimize the impact of a delay. So that is our overall goal. Well, I have not heard any studies, but I am going to assume, I really believe that it does help. So our goal is that they will lead no or less services in the future. So, and we do have children who we've served who, when we try and transition them to the school system for their special needs program, do not qualify, which means we've worked. So that is our goal, is to make sure that some of those kids do not need services or need minimal services upon graduation.
Thank you.
I think working in early intervention and then working with the older children. And when I received children from early intervention in the state of Georgia, the differences I saw in these children, and even looking at their history in early intervention, I saw a difference in a child that could listen and attend to language. I saw a child that had enough self-regulation that they could listen to a direction and follow through. If they were upset about something, that you could redirect them, and that they had beginning imitation skills. And if it was a child like that was working with Carol in physical therapy, that the child already had some beginning motor skills or had learned to compensate for that area disability if it was in the motor area. But there were, and we also, these families came in empowered. They had the information on development that they needed. They felt hopeful about their child's future. And so the transition to a big school system setting wasn't as difficult, because they had the support of our service coordinator to help teach them about this next step, what they were looking at. And they became an active part of meetings at the school system where families that had not had those services weren't empowered to do that. So that was what I saw as differences when I taught at the preschool setting and on, for parents who had these services. And the children and families.
And I think for me, just children with some type of gross motor impairment, my goal is to make them as independent as possible. Because with independence, their world opens up for them. And therefore, their interaction with their peers once they get to school is so much more I don't want to say normalized, because that's not the word, but they're able to interact with those kids because they have that independence and that confidence. Independence breeds confidence for a lot of my kids who are motorically impaired. And it also, it gives them that start, because we're already there. We're already gotten them to, whether they're in a wheelchair or whether they're in a walker or whatever it is, we've gotten them to that point already before they start school. And so I just think socially, it helps them to engage better if they've had that intervention already. Like I said, they'll have the confidence, they'll be able to move about the classroom themselves. So that's key. That early intervention is key for kids who have, a motor impairment.
And to piggyback on what Patty said earlier about the families, I do think that one thing as a service coordinator we do give them is the ability to advocate for their child and to realize that they are their child's first teacher. the knowledge, the words. I mean, we use different words in special education and in early intervention than they'll hear. I mean, even as simple as OT, because I've had friends, so what is that? So we do give them that vocabulary, and try and make them feel comfortable with the road ahead and prepare them for the road ahead as best as we can.
Exactly.
I appreciate that, because starting elementary school is intimidating for our little friends. So I love the idea that independence breeds confidence, and appreciate what y'all do to make that happen. So if somebody recommends that my child needs to be evaluated, what does that process look like? What should I be prepared for as a parent if it comes to testing or evaluation?
So if your child was referred to Babies Can't Wait, we have 45 days from that date to get everything in place. And in that 45 days, we set up a meeting, an initial meeting, which we call our intake appointment. At that meeting, we go over everything that Babies Can't Wait can do, your rights. We do a screener, even if you come with one, so you can see where your child falls. Typically, we've been doing what we call an ages and stages questionnaire, and I think that's been done across the state, but some form of a screener, just so we can find out where you are. And then after that, we talk about who you fit, what are your concerns, and trying to address those. What did your family bring to the table? What do you need from us? After that appointment, then we do schedule an evaluation. The evaluation looks different depending on where you are, and I'm sure it looks different across the state as well as different across the nation. So for us in Cobb, it's always 2 people there. We do 1 test. Some counties, it's 2 people there. They do 2 different tests. But in the end, your child's evaluated. The criteria to be eligible is a significant delay in 1 area or a moderate delay in 2 areas. Once that's done, we go ahead right into making a plan. And that plan includes whatever outcome you see that you want to do or accomplish for your child. What do you want your child to be doing functionally in your home that will make your life easier? And that's it. I mean, we go from there. But again, we have a very short window of time. It is 45 days from the date that referral is received that we have to have the intake, the evaluation, and the plan written.
And just to add on to what you were saying, Donna, the third way would be to qualify for services would be informed clinical opinion, because we have some kids who come in and they're just, they don't have that much of a delay, but we're not feeling good about saying, okay, you're good, so we will with mom and dad's, input and our input, we'll say, you know what, I think your child will benefit from services, even though they may not qualify in the other 2 ways. As a team, we feel like, yes, let's provide them with services, just to give them a little boost. And also, I think a lot for our informed clinical opinion kids is education to the family, education to mom and dad, that, you're seeing this right here, but, let's give you some strategies on how to work that out. So that's the other way too.
And then some families come into us where they've had a service. They might have had something in the community, like at a clinic setting. And for different reasons, they seek out our early intervention program, which is primarily based in the home or in their whatever their child is at during the day, the daycare center. So some families come into us like that, and they would like a different service, or they want additional information about their child's overall development. And then some families seek out additional resources if the child becomes eligible. So we're providing those links for families too.
And also, I did forget, there is another way. We do have children who would come into our program who we consider category 1. So there are some medical diagnoses that we already know possible will have impacts in their development. And so those children are a lot of times we get, depending on that diagnosis, we get those kids a little earlier than we get the general population. But yes, those kids too, like we would get a child who has a diagnosis of Down syndrome pretty early on, as opposed to a child who has no diagnosis or a diagnosis of maybe autism. We would get those a little later.
Okay, that's great. And I wonder if you come through this Babies Can't Wait or another federally funded program, how does the plan that you create in the early intervention program follow our children as they move into school?
So the plan itself doesn't technically follow them. I mean, we, at a certain point, 6 months prior to that child turning 3, we then contact the school system so that it could be a seamless transition. But the child has to meet criteria for that school system. So part of the role of the service coordinator is, at the age of 2, is to start preparing that family that, okay, you have 1 more year with us, and then we have to send you somewhere else. You will then go Head Start, school system, private preschool, whatever is the best environment for that child at that time. That is in Georgia. I think some states do have where their early intervention and their school systems are together, but in Georgia, they're separated.
But it's part of the federal law that transition piece occur with all early intervention programs across the country. So the role that Donna plays as a service coordinator and service coordinators play in Georgia is part of the federal law to help with this seamless transition if a child is going to continue to need services. That's part of the federal law. So
that's great. Thank you. I wonder, how would you all recommend navigating between pediatricians, service providers, ABA therapists, just to maximize the benefits? Donna, is that your role to help parents kind of figure out which pieces they need and
yes,
how to plug in?
It is in some ways, because parents always want more. They want it all. And a lot of times they feel like the more they have, the closer their child's going to get to being either normal, fixed, whatever, typical, whatever their thoughts are. And so, yes, my job is to help them to navigate and realize that we do have to let Johnny be Johnny and Johnny be 2 and not just have therapy all the time. And also to look at how natural learning takes place. And that's where our therapists come in, because they teach them how to work on those skills during just daily routines. And but yes. And another thing is how to help these people communicate, because even if you might have 10 people seeing Johnny, if those 10 people aren't communicating with each other, then Johnny's getting 10 different thought patterns, or so he's confused. I mean, and the parents are confused because, the PT is telling him to do this thing, the OT is telling him this, and trying to coordinate all that and have a life is a little hard. So it is trying to help families learn to balance and to prioritize.
And if we do need to communicate with other service providers, we've done releases. Because like Donna said, our goal is to embed intensity of early intervention into the family's daily routines, and families to understand the importance of that and how powerful that is. But if they choose to do a private therapist or ABA person, we want to connect those dots for this family. So if a provider in the community says he did really good during this therapy session, well, what strategy did you provide, and how can I embed that into the child's daily routine? And if the family becomes kind of overwhelmed with connecting those dots, we could get a release and work in collaboration with that outside therapist for all of us, because we're all focused on the same goal. And so we have done that, where we've put out releases and with family permission to connect the dots for families.
And I think this is that interaction between all the clinicians or therapists or and specialists that a child may have to go to. This is the beginning of really empowering our parents you have got to be an advocate for your baby, because sometimes we can hold their hands too much. And so we have to we have to empower them to, make sure when you go to the neurologist, you need to tell them that babies can't wait. And yes, I know my physical therapist is going to want your report. So can, send it back to her, or, that type of thing. That's the important time for our parents to really make sure those connections are made. Because if not, sometimes going to specialists is intimidating, and so I also help my parents. Okay, you're going to see the orthopedist. I prepare them. What questions do you have? Write them down and pull out your list when you go. And then I want to see them answers when you get back to me, so communication, like Donna and Patty has said, is key. And they need to learn that it starts now, because you're going to have to do it when they get to school and beyond. So.
But when they first get these evaluations, like if they get an autism evaluation or an ABA report or a report from a neurologist, that our team in the early intervention program is willing to sit down with you with that report. Or if you're overwhelmed, like Carol talked about, what questions can you ask that provider who did that report, that specialist. So we're there for that too, because they're receiving those reports at home. They're on their own and they get overwhelmed. Mm-hmm. And we don't want that for them. We want to support them through this process as they're making decisions for their child.
Absolutely.
That's great. And I would love for y'all to say something. I know about there are high costs associated with some of these therapies once you move beyond Babies Can't Wait. And I know that and this may just be a Georgia thing, I might be confused, but I know that there's a grant process that you can apply for some waivers, for some cost assistance. What programs should we access to help defray some of the costs if that's prohibitive in getting the therapies that our children need?
So if you have a child that has a diagnosis, and it could be, a diagnosis, some form of a diagnosis. So I guess, in other words, it has to be a child who would technically qualify for SSI Medicaid, which means they are disabled. That could include autism, Down syndrome, cerebral palsy. It can include a lot of things. But if you have a child who has a disability, then you can apply for the Demon waiver if your income is, or Katie Beckett, they have two names now, if your income is too high for the SSI. For a family who is below income, SSI could be an option for a child. Mm-hmm. For those other families, the Demon waiver, Katie Beckett and it is a waiver program. But it does require a lot of work. It does require quite a bit of therapies, or at least they want to see at least 5 therapies a week, I think is how it goes. But it is worth it if you can get it. And there are people out there who can help you, who can assist in applying for it at a cost. But that is the program right now that Georgia has.
And the Demon waiver, I know it's in other states. I'm not going to say it's nationwide.
It is. It is in other states. It probably has different names. Yeah. Other states might have other waivers, but it is a waiver, and that will be it. The other thing that I do try and talk to my parents about, especially those parents who have children who have what I would consider a long-term disabilities, and those families where there is going to be needs for the long haul, is looking at getting a financial planner who is very knowledgeable of things such as estate planning and things like that. Because if your child has qualified for a waiver based on a disability, once that child is 18, then they're an adult. So therefore they can apply for SSI on their own. But you have to be sure that you have made plans within your estate of how that child's going to survive if you're not going to be here. And so I do suggest that they do find those types of people to talk to too. But those are for those kids who are very involved and who will need some type of services long term.
Thank you.
And we have an adult with special needs in my family, and just working with Donna closely on just this case management piece. As any other service or any other therapy, we recommend for parents to really look around. Some families, some of these professionals have very high price tags. Other ones are more within reason. And I know parents have really benefited from talking to other parents about resources that they have. So all this long-term planning that Donna's talking about, just that they look around, just like they looked around for maybe a physical therapist that they wanted to work with, or an ABA therapist. And that is recommended.
That's really helpful. Thank you. How do we best advocate for our children when we come up against long wait lists over and over and over?
Ooh. Well,
That's a good question.
I think my thought is, we really need to advocate for the state. I mean, as a state, we need to advocate for better services for children. And so, one of the problems we're looking at now at the state in early intervention is the lack of service providers. And I think that lack is not just within us. I think it's all over. Part of it is the pay. Part of it is just that, I guess, I'm not really sure, but there's not a lot of government backing in the state for things like this. And so therefore, I think to advocate for more services, we need to advocate for the government to realize that these services are important and that we don't need to be the first one on the chopping block, that our kids are losing out. And if we advocate that way, I believe that there will be more service providers and less wait lists.
Yeah. And I think one way, if a child is already in Babies Can't Wait, is to get involved with the LICC, which is, y'all gonna help me, local interagency
coordinating council.
Thank you. You know, get involved with your local one, get involved with the state, you know, because, you know, they have meetings with those folks who make those decisions. And so, we know we need people who will speak for us as providers at that state level, you know, so.
And then on a practical note, like I've thought about this because I didn't have an answer for that. So if you're talking like a wait list for like a developmental ped or like a therapist or a ABA person, one of the things I always tell parents to do, especially when it's a doctor type person, is ask do they have, because a lot of the developmental peds or like Marcus and those people, they do have what they call a cancellation list. So ask for that. You could do the same with a therapist or an ABA people. Just ask, be one of those people who call every couple of months, you know, hey, just checking to see what Johnny is on that wait list. But that's practical. But again, it's more so we need to look at where we can get more providers to provide for those children.
Yeah.
And I think a couple other things, I know in the world of autism, there's a lot of grant projects where families could get into services much quicker. So a place like a Marcus Autism Center for families to ask, what are the grant projects? And if they qualify for one of those based on their child's need, that can expedite services for them. And I think for families to realize too, there is a lot they can do at home of embedding the intervention strategies that we are providing here or any provider that they have. There's research to show as they increase that intensity at home, just in daily routines. So they're doing it all day, that the intensity is providing progress for these children, that it is very important what they are doing at home. The other thing that I think has developed since COVID is there's a lot more free webinars. There's a lot more free resources. There's a lot more websites. And this is providing free information where in the past, even as professionals, we had to pay for all these webinars or these trainings. A lot of these services and that are provided online are free. And I think some of the people that are doing it are Baby Navigator, Autism Navigator. You know, you've got your CDC Milestones, which is a great one. And it provides so many free resources that have built up even since COVID. You've got websites like pathways.org that are providing so many great resources. So I think that has really built over the years, and families and free training programs that are coming out of like your Emory University, your Marcus Autism Center, these different places that are providing great webinars for families, fantastic ones for families that are free. So that has really changed in the last few years. That's what I've seen.
That's great news. Those are the questions I had for y'all, but I'm curious as we close, if there's anything you'd like to leave us with in terms of parting words that people may want to take with them as gems, and appreciate so very much your time and energy today. Appreciate what you do and who you are to our families and to these sweet babies. Grateful to be in your midst. So with that, I'll give you the opportunity for our closing words.
I think it's great to be in the setting with the church programs. The church programs over the years have just what's being offered to these kids. They're so developmentally appropriate, looking at numbers and looking at welcoming all these children that we serve into their models. It's just a blessing for us to walk into those settings and see the inclusive nature of those settings. And we appreciate that because sometimes our children are more isolated and aren't accepted into some of these group settings. So I thank the Christian community for doing this, and providing these kind of programs.
Thank you.
I think for me, just to say that, reiterate that, as parents, your kids, and don't be afraid to speak up and be advocates for your children. And sometimes that means you got to push pediatricians and to get what you think you need. And even if you're feeling that things are not quite right for a child and you do refer them to Babies Can't Wait and they don't qualify, that's like, whew, okay, we're good, and it's okay for you to do that. And we're fine if you come and we're like, okay, they don't qualify. That's a good thing, So just, and then to piggyback on what Patty was saying, there is so much information out there. And I appreciate what you're doing, providing, families with those, collecting all those resources for families. But just look around and find those resources and connect to people, talk to people. Sometimes we're like, oh, they're not going to understand they don't know what I'm talking about. Yes, there's somebody out there that does. So be open, talk to people, look for resources, Facebook, get on and you just start talking to somebody, you'll find somebody that knows what you're talking about and can help you with some type of resources. So that's all. That's what I was.
Well, y'all said it all. So I have very little. As a parent, I say go with your gut. So you do what you feel you have to do. There is lots of information out there. I say look at some of it and discard some of it,
right?
Because it becomes overwhelming. And look at what you have as positives. So look at what your strengths are, what you're trying to identify. All of those is because you will need them. And gain as much knowledge as you can from whomever you come in contact with, because in the end, you're going to be the one who's going to be there with your child for the long haul. And you're going to be the biggest advocate, the biggest teacher, everything. You are that child's world. And just remember that.
Thank y'all. I'm going to click here.